Hi guys, welcome back to another episode of Scoop and Debunk. Of course, I'm your content creator and host, Megan Zara Walsh. For those of you who don't know, this show takes under-discussed health, well-being and lifestyle topics and aims to debunk myths and misunderstandings associated with them. Okay, now, I don't really want to alarm anyone, but a debilitating yet still mysterious illness is on the rise. Lyme disease is an underreported, under-researched and most often devastating disease known to be transmitted by ticks. Lyme's wide range of symptoms tends to mimic many other illnesses, making it highly difficult to diagnose. As a result, there is a frustrating controversy that still exists surrounding chronic Lyme disease, as it's pretty much complex and it's often disregarded, which means that many patients will struggle to obtain the care they need to regain their health. One thing that people don't know is that everyone reacts to Lyme bacteria differently. For instance, my tail began in 2013 with a sharp pain in my knee, which resulted in years and years of hospital visits, then an inability to walk for periods at a time, and mysterious symptoms that baffle doctors, including severe inflammation, joint swelling, and worst of all, in 2017, short-term memory loss. Drawing on my personal experiences today, I thought it would only be fitting to conduct an interview with an expert to help shed light on misconceptions by showing how the disease operates and hopefully building more compassion amongst the public. So guys, that's why in a few moments we're going to be speaking with Dr. Daud Mohamed, who is a registered specialist in infectious diseases based at Breakspear Medical in Hertfordshire. But first, we went out on the streets of Luton to ask the British public what Lyme disease is. Here's what they told me. What is Lyme disease?
I'm not sure.
Yes, have a guess.
Lyme disease, is it? I don't know. Is it mental health?
Lyme disease. I don't know about that.
Not sure.
I don't know about Lyme disease.
Lyme disease?
Yeah, Lyme disease.
It doesn't really ring a bell anyway.
I don't know what Lyme disease is, but I know you can get them from ticks.
Something to do with the body. Like, it physically impairs you some way.
Okay.
Yeah, I think it does, innit? Physically impairs you some way, Lyme disease.
Did they eat too many limes?
No idea.
No idea.
I think it's an infection
Keep going.
that gets to the animals or humans.
When you eat too much limes.
Memory loss?
Something to do with bones, like similar to like brittle bone disease or something like that.
Lyme disease. I don't really know.
Is it lame? When somebody is lamed?
When they're lame.
Yeah?
Like a limp thing?
Yes?
Okay.
Like when you get a stroke or something.
Well, from what I understand, it's like you get beaten by some kind of insect, and then your skin gets all spotty.
Okay, well, it's clear from the VT that there seems to be a lack of education and awareness surrounding Lyme disease. So to help us increase public knowledge on the subject, we are now joined by Dr. Mohamed. Welcome to you. Thank you so much for being here today.
Thank you for having me.
Perfect. So, Doctor, can you please describe to me what Lyme disease is? Because there is clearly a misconception around the subject.
Yes, and I agree with you because it is known that it is an infectious disease and it's caused by a spirochete, which is a bacteria, and people they can get by the bite of a tick. But it is more than that because usually the people they don't come on the view of the doctors when they are acute, because usually the acute phase it is the one that a lot of people they don't have it. So it is more than infectious disease with a tick bite, but it is more than a chronic stage.
Do people look like they're sick? Because, you know, there's a lot of misconception about that as well. What are the symptoms?
Yes, the symptoms and various, and it depends on the stage of the conditions.
Okay.
Okay, and when you have got in front of you someone who have been bitten by a tick a few days and a week ago, usually they have flu-like symptoms. Okay, so the big problem it is there because when you don't have the clinical feature of an acute Lyme disease, which is an evolutionary rash, a lot of people they don't understand what the people is wrong with them because they are missing the clinical feature of Lyme disease. For that reason, a lot of doctors, they said, oh, you have a flu, just take a paracetamol, drink a plenty of water. But that is more than that. But when they come to us like we Lyme and a literate or an expert and look at the history and understand the possible exposure of the tick and patient feeling unwell, it's very crucial, the acute phase, because that is when the treatment it is successful.
What is the difference between early stage Lyme disease and then late stage Lyme disease?
Okay. The difference it is because still the infection it is not causing a debilitating or more involving system. And the early stage, when you have got the patient in front of you and get the treatment within 2 or 3 or 4 weeks, the patient they have more than 90% success, the treatment to be successful. That is the difference between the early and the chronic. While the patient, as a Dr. Mohamed, Breakspear Medical, the patient will come to us in a chronic stage. And the chronic stage, it is when the condition it is more debilitating, and the Lyme disease, as you know, it is a great mimicker, can mimic a lot of other medical conditions, and that's one of the reasons that people have got failure the treatment.
Yeah.
So that is the most important. It's very crucial to see the patient in early stage, if you can, and understand the history, although you don't have the clinical feature, but the history behind the bite without any bullseye rash and giving the antibiotic that early stage, that's what makes a difference.
Yeah, because there seems to be this frustrating misconception for someone like me that Lyme disease can be cured in 2 to 3 weeks if you take the antibiotics. But can you confirm to me that for people that have had it for years, that doesn't work? What do you have to say about that?
I can confirm that 100%. And I have seen in my experience, people with a chronic Lyme disease, they might need longer treatment. And we have seen the people, I cannot say that they are cured, but at least the quality of life come back. And they might need it longer, not 2 weeks, not 3 weeks. They might need months. Some people I've seen it, they might need even years of the treatment. The reason why it is not only the chronic stage of the conditions, the people, they might have other co-infections.
Can you name me some of the symptoms that someone in the late stage might have, just for the public to know?
Yes. As I just mentioned at the beginning, the Lyme can mimic other conditions like chronic fatigue.
Yes.
A lot of people who come to us, they are chronically fatigued.
That's extreme tiredness, isn't it?
Extreme tired.
Yeah.
They cannot do anything. Some of them, they are drop their education. Some of them, they cannot go to work. That is the number one. Another symptom important is the brain fog. So lack of concentrations, short-term memory. Okay. Another important of late stage is the Lyme arthritis.
Yeah.
So the Lyme can affect the joints, okay? So
Yeah.
sometimes it's difficult as a clinician to distinguish between the normal osteoarthritis and the Lyme arthritis.
Yeah.
So what we can do to differentiate that, when the Lyme it is chronic and it's affecting the joint, usually they affect one joint more than one joint. So the Lyme arthritis is one of the late stage. Lyme carditis, Lyme can affect and can cause inflammations of the outer membrane of the heart.
Yeah.
That is one of the chronic stage. Okay. And I just mentioned to you that the neurological symptoms like the brain fog. Okay.
Yeah.
Those are also the symptoms of chronic stage of Lyme disease.
For example, I don't want to speak about the disease in relation to myself too much, but just from experience, for example, I've suffered with short-term memory loss, and then particularly I told you before the interview that my knees and my joints in my legs, and then this joint here as well, was affected in the past. But how do you diagnose something like that? Because it took me years in Ireland to get this properly diagnosed.
Yes. And this is the crucial point of Lyme disease. And
Yeah.
that is why a lot of people in the UK, remain undiagnosed because lacking of a test laboratory. That's number one. And number two, the Lyme, it is in a clinical medical conditions. And that is the reason why a lot of people, they don't have the TB called bullseye rash, as I told you. For that reason, a lot of people remain chronically ill. So it's very difficult to diagnose the Lyme disease and for lab testing. Usually you can do some getting some fluid from the joint and send it to the PCR, but usually also this is not gold standard to diagnose the Lyme.
Yeah.
Okay? The PCR, it is not that sensitive, but it is highly specific. And what does it mean that? When I say that it's not sensitive, and all the tests that are available at the moment, okay, I wanted to mention this is very important. It is in a serology. We look at the antibody of Lyme, IgM and IgG, and what we have seen it, more than 50%, the test is negative, while they still might have the Lyme disease.
Yeah.
For that reason, a lot of people come to us because we do very special tests and we send it to abroad because it's not available in the UK. That is one thing. Although even the tests that we send abroad, also they are not conclusive. But the most important here is very important to know, and for the public as well, is the clinical history behind the patient is when he started the symptoms, chronological, what happened before becoming ill. So that is what you need to put together.
That's actually interesting to me. What do you mean by like their clinical symptoms? Like, do you mean can Lyme disease be triggered by, we'd say, like stress in their lives or something like that? Could it be dormant inside you for a very long time and then come? Really? I actually didn't know that.
That's very important. Okay, one of the reasons which make the diagnosis of Lyme difficulty, it is number one, that the bacteria which cause the Lyme can inhibit the immune system.
Okay.
And that is one of the reasons that people, they feel unwell, and the test result can come back negative. Okay, so that is one thing. Okay, make the diagnosis difficulty. What I mean about the clinical is to look at it the possible exposure of a tick. Okay. Although a lot of people they don't have the history, so this is a big question mark.
Why is there such inaccuracies in the UK and Ireland with the testing? Because I would say the Irish kind of testing system is the same as the UK.
Yes.
And why do so many tests come back negative?
I think this is something that still we need to make a lot of research.
Yes.
Okay, and which make the diagnosis a little bit difficult. One of the reasons, and you mentioned yourself, it is that the Lyme can hide from the immune system. Sometimes the bacteria cannot grow.
Okay.
And when it's not growing, usually they don't produce antibody. But as an expert doctor, what you need to do is you go by the clinical suspicion and give the treatment. And what I have seen it, people coming to me at the initial stage with a negative test, but a very good suspicions of clinical history, give a treatment within a period of time, repeat the test, and the test come back positive. And why is that? Because, as I just mentioned to you, this bacteria can suppress your immune system. And when you treat with antibiotics, the suppression can be lifted. Your immune system now can become a little bit competent, and any infection remaining can produce antibody. So you might have a test positive, not at the beginning, but at the middle, okay? And that is the crucial thing, and I just, reassure my patients that, don't worry, now the things are going the right directions, and you need to continue the treatment. And you will get another stage where you will get a negative test. And that negative test is the one reliable and not the first one.
I know that this Lyme disease, it imitates other other illnesses, and so many people are diagnosed beforehand with other things. Like, for example, before I was diagnosed, they thought it was MS, they thought it was lupus, and it was going through this, and then it was coming to the stage where they didn't really know. Can you explain for the public, like, why is this?
Exactly.
Like, why are so many people misdiagnosed?
One thing should be clear, okay?
Yes.
I cannot tell that there is a cause and effect. And I have seen it in people who have got a neurological condition like MS or LS, okay? And then we look at it for Lyme, and then they have got the Lyme disease positivity, okay?
Yeah.
By treating, their quality of life improve. That's the one thing. The second thing is very important that you asked me. Yes, some of my patients who come to my practice, they are chronic fatigue syndrome. That is what the NHS usually they give it because they don't find any underlying cause of their problem. So they might suffer chronic fatigue or ME. And what we do at the Breakspear Medical, we do very thorough, extensive investigations, including the Lyme and Lyme confections. We do the viral panel. We do the stool test, the comparative stool test. So that is the holistic way that we approach our patients. And you will find something, okay, not necessarily the Lyme, but improving other factors as environmentalists, patients, they might get better. And you treat the Lyme subsequently.
With regards to, we spoke a little bit before about arthritis and it kind of mimicking arthritis. Could you go a bit more into detail about that for me?
In literature, they said the Lyme can affect one joint. That's why they call mono and arthritis, like knee or hip. But in my experience and in my clinic, what I have seen it, those kind of arthritis a migration type of arthritis. So the patient is pain, it is not just for one joint, but it can affect, for example, week or so and the shoulder, and then you can, and the patient in 2-3 weeks time, and then the pain move to the hip or to the knee and or to the ankle. So migratory type of arthritis. That is the things that sometimes you need to differentiate from other type of arthritis like osteoarthritis.
For me, I would go to, in Ireland, I went to rheumatology, and this was the time they didn't realise that it was Lyme, and they would say, oh, might be arthritis, but I find that, or excuse me, afterward, when I went to a private doctor, he said I probably developed Lyme arthritis. Is that?
Yes.
You know, that's still a question mark, but can you explain to me for the public? Because I'm sure there's more people out there that have the same thing.
And it can happen because what we know about the history of Lyme disease, and when we talk about these stages, one of the late stages is Lyme arthritis. When someone has been ill for the conditions more than a year, and then develop it an arthritis, that could be the Lyme disease. Okay.
Yeah.
And the doctor, when he took the history and he got that suspicion that you might have got the Lyme, he must run some lab test. Okay.
Yeah.
That might come back and show something, and with the treatment, some people they might improve.
Just for the public again, would you be able to explain to me what a typical day would be like for someone suffering with long-term Lyme disease and they're at their worst point?
Yes.
Like some of the symptoms they might experience.
Yes. Some of the symptoms are typical Lyme sufferer with a chronically ill patient. It is a bed bound. Most of them they stay indoor. They cannot function. So and also some of the patients they develop depression. The depression, which is not their usual personality, but it is the warning about the condition which has been there for years. So it is a really number of symptoms and signs that the patient they have. So they are chronically ill, chronically fatigued, mentally low, and brain fog, cannot concentrate, cannot go work, cannot do the normal task of daily life. That is the typical of people who suffer Lyme disease and chronically ill.
It's interesting that you say that, because I know other people that suffer, and a lot of people live with the kind of, they go through this kind of stage, like myself, where it's unknown. You're living with the unknown, and then the regular doctors say, oh, well, you're just depressed, you're just depressed. And I think that is probably the worst thing of all, because it's like, if the doctors don't believe you, who else is going to believe you until you go to an actual Lyme specialist like yourself? What do you have to say about that?
No, usually we have to reassure the patient. We must give time, listen to them, look at the history, do some tests, and then if they find that the case is the Lyme, with the treatment, the people they improve, and that's what we find really. And we know that when the patient tell you, Dr. Mohamed, I was fit and well, I wasn't having any problem, going to my work, going to my educations, but 4 years after having a trip for Highlands in Scotland, for example, and then become ill. So you will get the suspicion these people might have got the Lyme disease, although they don't have a tick bite or bullseye rash, but sometimes during the test, you can pick it up, and the Lyme or the Lyme infections. And with the treatment, although they're chronically ill, people, they might go back to normal life.
Another thing is, I don't think we said this already, but there's this misconception that people can't contract Lyme in Ireland and the UK. What do you have to say about that?
I think that is a misconception, and it's not true really, because in my practice as a Dr. Mohamed, since 2011 up until now, we have got 1,700 cases of patients with a Lyme disease who underwent almost more than 4,000 tests. The reason why the tests are more than the patient is because usually you need to do more than one test, because one test alone is not conclusive. Also, if you look at the NICE guidelines, they are southeast and southwest of the country are the most prevalent area with the Lyme disease. But what I can tell you, the whole country has got a Lyme. Okay, so it's untrue, and we are just a small clinic, but we have got that number of patients, and other doctors and privately also they have. And the reason why they're saying that the Lyme is not there, because there's no a reliable test. Okay, the people, despite being ill and the test is negative, they might have got other diagnoses like chronic fatigue or ME or depression or things like that. But the Lyme is there, and
It needs to be more recognised.
Exactly,
Yes.
more recognized.
I just have some figures here. So one study, I was reading this yesterday, one study showed 50% of people with untreated Lyme reported having arthritis-like episodes, while 81% of adults reported memory loss and cognitive issues. Like, these are very high numbers. What do you have to say about this?
Yeah, definitely that is right, because as I just seen at the beginning of the interview, I said the most important and crucial here, it is the early stage, and to see the patient in acute stage, and that is when the treatment is highly successful.
Yeah.
But that doesn't happen because we know the clinical diagnosis is not there, and also the tests, they are not, most of them, reliable. For that reason, a lot of people come to us chronically, and when you are chronically ill, as you just mentioned that figure, they have got a good number or percentage of failing the treatment. And unfortunately, a lot of people will have those symptoms lingering for many years.
Yeah, because that was sort of the main thing that I wanted to kind of show today, was about how, yes, at the early stages, it's easily curable, but for people who had it, we say, undetected for years, like we spoke about already, you can confirm this, that it's not curable, or might be curable.
No, usually I wouldn't use the word incurable or uncurable, and I would use the treatment will fail and the successful will go lower than 90%. One of the reasons is the chronicity and the presence of the co-infections and other predated and infections or other comorbidity, really. But again, say that, but still, even if you are chronically ill with a treatment, people, they might improve and they might get back their normal life. Even the people who have gotten a proper treatment in early stage, they might develop 10-20% of being chronically ill. Some literature, they said post-treatment Lyme syndrome. I don't use that word, I will use chronic, okay?
Okay.
So, what makes the situation difficult? It is the bacteria which cause the Lyme disease, which is a very difficult bacteria because it can become persistent to the antibiotics. One of the reasons it is, as I told you before, it can hide the immune system, it can develop in different forms. That's why they will be called a persistent form, and sometimes the conventional treatment will not kill. So some people, they might need a combination of antibiotics because of different form of the bacteria. Okay, that's one thing. And the second thing is we need to look at it other co-infections, because that bite can be transmitted not only the Borrelia but other co-infections. For example, Bartonella or Babesia or Anaplasma. So some of those things here, they need different antibiotics.
I have a little bit of a personal question. So for me, I've taken steps to sort of make my life healthier and my lifestyle better in order for it to be kind of livable. And since being diagnosed, I started an anti-inflammatory diet. Yes. So I eat everything anti-inflammatory. But sometimes, you want, the odd maybe pizza or something. Yes. And I find when I eat, we'd say, a normal slice of pizza, I start getting aches in my arms, I get pains, this inflames, and then it's the same when I drink. I don't really drink alcohol because of this, but when I drink alcohol, I get pains. Can you explain to me why that is?
Yeah. I think it's still these symptoms that you mentioned, and it could be the Lyme disease. Yeah. Because when the Lyme, affect you and inhibit your immune system, you can become intolerant or sensitive to the food that you eat. So the Lyme can do that. So that is the reason why, I'm not sure if I mentioned this, we look our patient holistically, because you don't just look to the conditions, but you just look at their diet as well. So for that reason, people might benefit, taking some special type of diet. For example, we have got something called an ideal diet for life. Yeah. So mostly organic food, and then removing, for example, some trigger like gluten. In my opinion, in your case, inflammatory diet, it doesn't exist such as that kind of diet. But some people, it can work. Some people, they might get benefit ketogenic diet. But in your case, when you say the pizza, it's very important, and it could be gluten. Yeah. So what we tell or advise our patients, we have got also nutrition therapists, okay, they go through their diet as well. So it's very important that you also have a proper, correct diet to follow. For example, removing the gluten or sugar, you may improve because alcohol contains sugar. Usually when the patient come to you, you need to filter your patient. Everybody doesn't candidate for antibiotics. Yeah. Okay. Some people, they have got a side effect, intolerance to antibiotics. So we have got an option which we call herbal Lyme treatment. So we have got some natural antimicrobial. Okay. So we can use that. Okay. But when someone is acutely ill, yes, sometimes antibiotics, which is a short period of time, 3 weeks, 4 weeks, Yes. But what you need to do it also, you need to look at it also deficiency of minerals and vitamins. And also that is something very important for the patient.
Yeah.
If they have got a gut issue, you also need to adjust that.
Yeah.
Okay? Some people, they might have got yeast or other bacterial infection or things like that. So yeah, by looking at not the condition, but as a person, that is what some people, they might improve it. Because those people are already chronically ill. And as I told you, the Lyme can mimic a lot of medical conditions, and it can affect different systems and organs. So that's why sometimes you need to look at it as a whole, the persons. And then whatever kind of abnormality found from your investigations, you need to treat one at a time. And that is when you can get a good result.
Just have one final question for you. So
Yes.
basically, what would you say to people out there that are suffering, that might be suffering from Lyme and they're frustrated with the system, but the thing is that they don't have like a lot of money to kind of seek private treatments? Is there any advice that you could give them?
Yes, that's very important questions, and a lot of informations are available online, and they are a natural way that sometimes you can boost the immune system, not directly killing the bacteria, but boosting the immune system. People, they might improve with taking some Lyme herbal treatment. If you wanted to mention, there is a book written by Professor Stephen Puna, and that is a protocol of a supplement. Also, it's important to mention here taking some supplement, some multivitamins, especially those people who are chronically fatigued and chronically ill, and taking vitamin D supplementation on a daily basis, taking vitamin B12, very important for the neurological symptoms. So those kind of combinations of Lyme herbal treatment are available online, and taking multivitamins, things like that. So together, those things might help some cases. But again, some people, they might need, if they never had the antibiotic treatment, they might need to be treated with antibiotics. And unfortunately, that is also the case.
Thank you so much for coming on today. I really, really appreciate it. I wanted to get this kind of topic out. I want people to speak about it as well. So thanks so much for being
here.
Megan,
for having me.
That's the camera that we say goodbye in, so you can say goodbye.
Goodbye.
Shout out to Dr. Mohamed for being here.
Thank you.
Right guys, well that's it for today. We hope you've enjoyed today's informative episode about this invisible illness, Lyme disease. So please look out for symptoms, take care in wooded areas, and if you feel like you exhibit some of these symptoms, I urge you to get in touch with a Lyme specialist. Like always, if you've any questions or you simply just want to give your opinion on any of the themes, don't hesitate to drop a message to the email address provided in the information box below. Right, well, I'm off now. Thanks a million for watching. Please don't forget to like, share and subscribe. And please tune in next time where we'll meet another wonderful expert for more scooping and debunking.